You can see both of us okay?
Yes.
Oh, that's good.
All right. Thank you so much for being here today. Could you first introduce yourself?
Yeah, hi, I'm Dr. James Vredenberg. I'm an oncologist here in San Francisco.
So could you walk me through your journey towards being a physician? So where has your academic and personal career led you so far?
Sure. So I'm the fifth of six kids. So my dad is a dentist. He always wanted one of us to be a physician.
I see.
The first four didn't make the cut. So there was a lot of pressure on me. The sixth definitely didn't make the cut. And then I was always good in science. And when I got to University of Virginia, my undergraduate, I fell in love with psychology. And I realized medicine is a perfect combination of trying to interact with people, help people, form relationships, but you really had to know your science to be good at it. So I thought it was a perfect combination for me.
What was your favorite part of attending the University of Virginia?
The females. Yeah. It was, well, I actually went down there to play baseball.
I see.
So I grew up about an hour north of New York City. It was a really good high school. I got down to University of Virginia, 60% of the kids are from Virginia. Well, my first 2 years, the classes were less advanced than what I took in high school. So it was a little strange academically, but it worked out well. I developed a lot of good friends. Baseball was good and everything.
So you mentioned that you were really interested in psychology. So once you got to the University of Virginia, when you were taking those psychology classes, is that when you decided that you were going to be a physician?
I decided in high school, because I did well in science, and my mom was sick, so I wanted to make my dad happy. So I said, I'm going to give this a try. It really doesn't matter if I don't do well in my pre-med classes, but I was going to try for him. And then with the psychology, I said, oh, this is perfect. You know, it's a nice combination.
Yeah, I love that. So you specialize in oncology and specifically neuro-oncology. What's the most enticing part about your field?
Well, it's been a long journey. Initially, I wanted to do psychiatry because of the psychology and helping people in need. But when I did my psychiatry rotations, I realized that's all about mental illness. And I didn't really understand mental illness. I wanted to try to help people who were quote unquote in a healthcare crisis or a mental crisis. But basically they had all their faculties about them and everything. But then when I started doing internal medicine, I said all the best patients are cancer patients. They're so motivated, they're nice, there's nothing like the science in oncology. Every week we have something new, so you have to keep up with it. It's a constant challenge, so I love it.
That's great to hear. So going off of that, what are you most excited for in the field of oncology and the next generation of neuro-oncologists?
I think the most important thing is we're finally harnessing the immune system to fight cancer, because our bodies form cancer cells every day, and our innate immune system gets rid of them. Well, as I was doing my training in oncology, it was all about chemotherapy, toxins, poisons, and I took a step back and I said, I think we're barking up the wrong tree, because it doesn't work for insects, it doesn't work for bacteria. Why would it work for cancer? Cancer's smarter than any of those and everything. So I think really targeting our innate anti-tumor immune system is going to be the next key to making advances.
Could you talk a little bit more about that, specifically the RNA? So a little bit more about what exactly they're going to be working on.
Sure. So many cancers are similar. You know, we say, oh, this person died of lung cancer, this person has pancreatic cancer. For me, cancer is cancer. There's a few mutations that really form the backbone of cancer. One of the most important is called programmed death ligand 1. So it's a protein that cancer cells produce that shuts down our immune system. I wish I discovered it, but it's like, wow, how is the cancer so smart? right now, immunotherapy are antibodies to program death ligand 1 or PDL1. So that wakes up our immune system. So all of a sudden that goes and attacks the cancer cells. Unfortunately, it hasn't worked at all for brain tumors. I think the brain is the last unknown frontier in science. We just don't understand it. We don't know how to treat it properly. We don't really know how to treat the tumors there. So I think the next generation of neuro-oncologists needs to really work on the immune response to target brain tumors.
I'm sure there will.
Hopefully. Hopefully you'll be one of them, you know?
We'll see. So what's the biggest reason you would tell someone to choose medicine as a career?
Every day I wake up energized, helping people, learning. It's a fabulous combination of, I think, the challenges that all of us thrive on day to day. There's certainly some interpersonal stressors, but it's part of life and everything. There's very few people, very few occupations that have the opportunity to help people form relationships and learn at the same time.
It's such a field of growth.
Yeah.
And then, as a contrast to that, what is the biggest reason you would tell someone to stay away from medicine?
Well, unfortunately, medicine has become big business. And it's very frustrating, having been in it for 40 years, to see that hospitals are motivated by the finances, not the quality of care. They really push the physicians to see what I think is too many patients, and they don't allow us time to learn, write new protocols. How do we advance the field of oncology through clinical trials? Well, you need time to think about it, talk to other people, and with the business of medicine, they're really limiting our time to think.
Do you have any personal experiences with that, or how that's affected you, specifically with big business?
Quite a bit. Unfortunately, when I came up here, a administrator, I was complaining about how many patients we have to see and I don't get any time. I'm doing notes on my vacations, or every weekend I have to do notes to catch up,
Right.
And it's hard. It impacts my family time. And he said, well, physicians are like any janitor. You're just a dime a dozen. We can hire a physician anywhere to take care of people. And it really bothered me, because I said that person doesn't understand the uniqueness of the patient-physician relationship and where we're coming from.
You mentioned your time with your family that I would assume is important to a lot of physicians. How has that changed over the years, and has your work-life balance gotten better?
No, it's gotten worse, with the finances of medicine. So initially I was at Dartmouth in an academic position. Then I was at Duke for 22 years in an academic position. Academic positions, you have 2 half days in clinic. So you have 4 full days to think, to write, to do research, and I had more time with my family. In more of a clinical situation, it's 4 full days in clinic. So there's very little time. So unfortunately, I haven't learned that balance between I give everything to the field of medicine. Fortunately, my wife and kids seem to understand, or they prefer that I not be home, so they encourage it. But it honestly does take a very understanding and passionate family to support you.
So you worked in academic positions. Was that with university students, medical students?
You name it. Yeah, I used to do a lot of teaching undergraduate, like biochemistry courses, because they wanted someone that could tie in some clinical venues or vignettes in addition to the basic science. So I did a lot of teaching both in the classroom but always in the clinic. One of the best things about working in a community hospital like St. Francis, we do have residents and fellows. So I like to work with them in the clinic, so I feel like I'm passing on knowledge and allowing them to develop their own style as a physician.
Is there one career option you prefer, going towards the academic versus the clinical route?
I think the academic route is far preferable because they protect your time. You have time to think. I always wanted to be part of the advancement of the field of oncology, and I feel like sometimes in the clinical realm, all you're doing is trying your best with the patient in front of you. I'm not thinking of how can we cure this cancer, so I strongly prefer the academic. Unfortunately, the academic world, the salaries are usually half to 1/4 of what they are in the clinic. Again, business of medicine and everything, but if I had to pick and choose, I would stay in academia.
So, what personal qualities do you think are most essential for success in medicine?
I think real strong determination to succeed. It's not so much the competition with the other students, it's all of us have to want to succeed and be the best we can as a physician. The second thing is you really have to care about people. It doesn't matter what patient is in front of me, I have to do my best to try to help them. It's different for different patients, but I think those are the two main qualities.
Speaking of patient care, what's a memorable experience that you've had with a patient?
Gosh, I feel like I should write a book because there's been so many over the years. Down at Duke, I started in the bone marrow transplant program. We treated a lot of breast cancer with bone marrow transplants, and many of the patients still communicate with me because they feel like we cured them together, we're in this together. But there's so many experiences, so many people that were given a few weeks to live that now who are years out because of the treatment, because of luck, I'm not sure what, but those are the sort of experiences I remember. It's hard not to see the suffering that so many people have, particularly in oncology. But the other part of oncology that I do like is to make sure people don't suffer. We're not going to win every battle, but no one should have to suffer.
How important is patient care to you, and how would you say that your patient care skills have evolved over time?
I think that that's what motivates my life, patient care. And I think I've gotten a lot more empathetic towards the patients. When I came into oncology, it was hard to have the knowledge base to apply to individual patients. I feel like over time, I've worked hard to develop that knowledge base, so now I can individualize my care, and I feel like I provide much better care for them. Every patient is different, some want aggressive treatment, some don't want aggressive treatment. That's not for me to decide. I can counsel them, but at the end of the day, I'm there to support them, and that's what I feel like I've gotten much better at.
Of course. So, what do you see as the biggest challenge in medicine today? And do you have any suggestions as what we can do to work towards it in the future?
Yeah. If you think of medicine as a whole, I think the biggest challenge is I think we need a one-payer system. We need to take the financial incentives away from drug companies, from insurance companies, from hospitals, from physicians as well. And I think we need to make it more about caring for the patient and less about the success of whoever you're working for.
Yeah, that's what it all started from, obviously.
Yeah.
Patient care. And going off of that, do you also see that as the biggest difference from when you started practicing as a physician versus today?
I think so. I really, because all hospitals were successful when I started in the mid-1980s. And over time, so many smaller hospitals have closed because of finances. And I never had to contact an insurance company to ask for permission for a particular treatment. I prescribed the treatment, they would pay whatever. I didn't know what they paid, I didn't care what they paid. I just wanted to take care of the patient. Now I have to spend at least an hour a day on the phone with insurance companies trying to get tests approved, trying to get new treatments approved. So it's a frustrating part of it.
Are those common barriers that you face like on a day-to-day basis?
Yeah.
Are there other things like that with finance companies and stuff?
It's more the insurance companies, and things. But yeah, pretty much an hour of my day is trying to deal with insurance companies, trying to get my patients the treatment that I think they need.
And that's taking away time from patient care. That's
From
so
patient
important.
care or my time to think.
Personal.
When I do my notes, I'm constantly thinking, what is the right treatment? Why about this? Well, a lot of times I have to stop and look up on PubMed, what is the latest research in this? We can't know everything, and that's a very satisfying part of medicine. But when you're dealing with insurance companies, it takes away my think time.
Mm-hmm. So, what is the most important advice that you would give to someone who is unsure about pursuing medicine?
I would volunteer in a clinic. I think cancer clinics are the best because the patients are all highly motivated. Is this something that excites you? Because it's a very difficult road. 4 years of college, 4 years of medical school, at least 3 years of residency. If I specialize, so it was another 4 years of subspecialization. You really have to be committed to it. So I would volunteer, try to get a sense, boy, this is what I really like. Shadow someone who's in it, who is passionate about it. That's what I like working with the residents and the fellows. So they see, gosh, he seems to be excited about this. Well, I am, it's a real privilege to care for patients. So I don't want anyone to think about medicine who doesn't have that same passion.
Would you say that your passion has brought in a lot of people to medicine if you worked with those academic?
Yeah, I think that a lot of my passion has allowed residents to go into oncology. I'm not so sure, when I was doing a lot with undergraduates down at Duke, that I encouraged many people to go into medicine, because I'm kind of old school in that I really think it's our lives to give to the patients. It has to be your primary focus. When people start talking about, I want to do this with my family, I want to move here, I want to do that, well, then don't go into medicine. Because they're very valid requests or goals, but I feel like you have to give up a lot to be successful in medicine.
What would you say the biggest thing that you've given up is for medicine?
I guess time with my family, Unfortunately or unfortunately for them, and things. I guess sleep deprivation is another. For a long time down at Duke, I was on call every third night. For a lot of those nights, you don't sleep, so it's hard to get up the next day and function. But it's amazing how the brain learns to adapt, and it just kicks right in when you're tired. And you get done with the patient and you're even more tired, but then the next patient, you gear right up and you can do it.
I love that.
Yeah.
So what is the best part about being a physician in your opinion?
I think the honor to form a relationship with a patient and try to help them, try to understand how I can help them. As a fellow human being, not as just a physician, not as an expert in the field. I feel like we're in this together, so that patient-physician bond is far and away the most important.
That's all the questions I have for you. Thank you so much.
Good. Absolutely.